Hi everyone and welcome to today's webinar session. I will be introducing you to some of the functions and accessories that are available to complement our CareFlex specialist seating range and water cell technology. This won't be a comprehensive list of all the functions and accessories that are available, but I thought I would introduce you to some of the key ones that can help your client achieve good seated posture. This topic will be split into two webinar sessions, part 1 and part 2. Today, part 1 will focus on some of the main functions and the accessories that can support the pelvis and trunk. We have many different functions and accessories, especially with our tailored seating solution service. So please do get in touch to understand more about what is available or if you have any client-specific needs. Thank you and enjoy. Adjustability and flexibility are key features of our CareFlex specialist seating range. It is essential that each chair can be set up for the individual user, otherwise it can cause more harm than good. Adjustability and flexibility also allow the chair to continue to meet any changing needs, such as a progression of a condition or possibly improvement through rehabilitation. The chair dimensions must be based on the user's individual measurements, which will be determined during the assessment process. The way in which the chair is set up will influence positioning, and this can consequently impact on the client's risk of secondary complications, such as postural deterioration or pressure injury. The tilt in space function, or TIS for short, allows the whole seating system to be tilted while the seat to back angle remains the same. Therefore, it does not alter the client's hip and knee angles. This differs to back angle recline, whereby the seat to back angle adjusts to open up the hip angle. The tilt in space function can improve pelvic stability without affecting the user's critical angles for sitting. It can promote safety by preventing the user from sliding down the chair. It can also assist with head control by using the effects of gravity. Tilt in space can promote energy management by bringing the client into a resting position for a period of time to recuperate before then returning upright to continue with activities of daily living. And it can also assist with hoisting and positioning by utilizing gravity to bring the pelvis into the correct position at the back of the chair. Another key use for tilt in space is during pressure care. So tilt in space can be considered as part of a client's care plan to achieve effective pressure redistribution. Reposition an individual against the forces of gravity in different degrees of tilt can redistribute the pressure or the client's body weight going through specific body sites and ultimately reduce the risk of pressure injury. Research has found that even a small tilt under 15 degrees can be used to adjust pressure distribution through the back, but a greater posterior seat tilt of 20 degrees can then reduce pressures under the pelvis too. Tilt in space can indeed have a significant positive impact on a client's posture. However, there are times when tilt in space may be contraindicated or its use needs to be fully risk assessed and closely monitored by clinicians. A comprehensive assessment will be critical for the following users: those with swallowing difficulties, as we do not want saliva to pool in the mouth and then increase the risk of aspiration. Those with catheters, as it can increase the risk of backflow. And then those who require the use of a tray for communication or other activities, as a tilted seat position could take away that functional ability and independence. Sometimes tilt in space is actually most effective when used in conjunction with another function, and that's back angle recline. So for example, If back angle recline is required to accommodate reduced hip range of movement, then using tilt in space in combination with it can reduce the shear and friction forces that might otherwise be present when using back angle recline alone. Another instance when tilt in space and back angle recline are best used in combination is for optimum pressure care. Research has shown that a 25-degree seat tilt combined with a 120-degree back angle recline can be effective in providing both muscle and skin perfusion at the ischial tuberosities. Do be mindful, however, that it's not just about this one static position, and our clients actually need to move through different tilt angles to achieve regular and effective redistribution of pressure or their body weight through specific body sites. So let's now look at back angle recline. Back angle recline adjusts the angle between the chair seat and the chair back. So essentially, it is opening up the hip angle, which as we know differs to tilt in space, where the whole system tilts and the hip angle remains the same. When back angle recline is used appropriately, it can assist with our clients' comfort levels. It can help alleviate any pain associated with hip joint problems, reduce abdominal pressure, and even relieve hamstring muscles tension. However, clinicians must be cautious when prescribing seating with back angle recline, as it can cause a posterior pelvic tilt in clients who present with pelvic instability. It can increase shear and friction forces, and it can encourage an increased extensor tone if used inappropriately. Should these things happen, it can have a significant impact on our clients' comfort levels and their risk of developing pressure injuries. It is therefore essential that not only the client but their support network fully understand when and how to use back angle recline. This will form a key part of the client's care plan. I want to take this opportunity to cover another function that needs to be prescribed very, very carefully, and that is leg rest elevation. When used appropriately, it can help encourage a more comfortable and relaxing position for our clients. Research has shown that raising the lower limbs above hip level for 30 minutes 3 to 4 times a day can also help improve swelling and circulation. However, it's essential that leg rest elevation is only prescribed for those who have the ability to tolerate that range of movement. Leg rest elevation is not indicated for clients with reduced knee range of movement, as elevating the lower limbs will cause them pain and result in them tilting posteriorly at the pelvis and sliding down the chair. This can increase shear and friction forces and increase their risk of pressure injuries, not even thinking about the level of pain that this may cause them. There needs to be a clear handover on how to utilize it, or in some instances not use it at all. And this needs to be cleared, especially in multi-user environments. Please do get in touch with me if you want to know more about these functions and when and how to use them appropriately and safely. Now that we've covered the functions, let's move on to the different accessories that are available for the CareFlex specialist seating range. And we're better to start than at the pelvis. So the pelvis is the foundation for a good sitting posture, as it dictates what happens to the body segments above and below. Positioned at our client's core, it acts as a support system for their entire body. Now, pelvic stability is essential for movement and function. Freedom of movement in the upper limbs is achieved once we have effective stabilization at the pelvis and the trunk. Pelvic support that offers this necessary stability can also help normalize muscle tone, improve any related pain, and encourage normal movement. First of all, we have our unique seat base and cushion with integrated water cell technology. We covered water cell technology in our last webinar session, so please do check that out. It is essentially a dynamic solution for pressure redistribution that won't compromise on comfort, function, or stability. Following a risk assessment and where indicated, there is the option to prescribe pelvic belts, whether this is a 2-point or a 4-point pelvic belt where maximum stability is needed. Then there is the option to progress to a groin harness to provide maximum pelvic control and to help prevent the client from sliding forward in the seat. As with any belts, straps or harnesses, a risk assessment would be necessary. Another option on our chairs to aid pelvic stability, especially where tilt in space function may not be appropriate, is a seat wedge that can help to keep the pelvis towards the back of the chair by utilizing gravity. Moving on to trunk support. First of all, it's important to understand that our client's inability to sit upright may result in their decline in overall health over time, and this can be mainly reflected by altered physiological function. Trunk asymmetry can impair respiration, cardiac efficiency, swallowability, and even digestion. Starting with the least restrictive trunk support option, here we have the waterfall back seen on our HydroTilt. It consists of cushions at the lumbar and thoracic regions of the spine, and then a head cushion, which can manage posture and pressure without compromising comfort for those with good trunk control and sit-in balance. Then we progress to contoured backs, which provides gentle lateral support for the upper trunk. This type of back support will centralize the posture with the contoured pads, but will still allow for movement. Where more individualized trunk support is required, we are able to offer prescriptive thoracic control through adjustable lateral support. Here is seen in various different sizes to accommodate different needs. If a client requires anterior support to enable an upright trunk position, then we are able to offer chest harnesses, which provide comfort and support without restricting active positioning. On the right, you will see sternum harness, which can offer greater upper trunk stability while still allowing for this needed movement. For complex clients, we may need to progress to the Smart Seat Pro, which offers built-in, unique multi-adjustable back that can be quickly and easily adjusted to ensure that a range of postural asymmetries in our clients can be fully stabilized, accommodated, and where possible corrected from the sacrum through to the cervical spine. Thank you for joining me for another webinar session and part 1 of our introduction to specialist seating functions and accessories. Remember to keep an eye out for part 2, where we will be focusing on the functions and accessories that can support the lower limbs, the upper limbs, and the head. Thank you and continue to stay safe.